it is that time. And for those of you who have no idea who they just showed up for, I'm Jim Harrison. Says it right there in case I forget. I am an essential oil expert, plant-based medicine, or I should say plant-based ingredients. I don't really do medicine. And I focus mainly in holistic wellness and holistic beauty. Today, now I could go through a whole bio, but I'm actually going to do this. In a way, I'm going to give you my bio because the system that I've created, which is called, let's just pull that up, let you guys see it. Oops, it disappeared. Hold on a sec. I got to pull up that. I have to pull that up again. There we go. Yes, so anyway, the system I'm going to show you is the Holistic Essential Oil Triad. It's a system that I really just recently developed as a system, but I have been using it and I have been creating it over the 20 plus years that I have been working with essential oils and plant-based ingredients. So the Holistic Essential Oil Triad, which I'm calling here a system for aromatherapy treatment results. And I had another name that I posted up there because it's really about science, energy, and results, because this is what we're looking for. We're looking for results when we use essential oils. And I'm going to explain how I came about that because I'm going to put this together as a kind of a puzzle is what I'm going to do. Let me come back. I know who I am. I'm going to remove this while I talk about this. Now, I generally don't bring this up as part of my history, but I began life as a touring rock and roll drummer. And I mean, I was just born rock and roll. And I realized that that's really significant in the way that I teach, in the way that I learn, and in the way that I use essential oil and plant-based ingredients. So why am I bringing that up as a point, right? I'm just rock and roll. And if you really understand or know rock and roll, it's a music form that is very loose, very random. I don't read charts. I don't read music. I self-taught as a drummer. And so the whole thing about being in rock and roll, and this is how it relates to my work in essential oils, is to do it without learning, to do it without charts as a drummer. I listen, I pay attention, and I play. So it's about experience, it's about skill, but it's very much about listening. I sat in with I was doing a thing in Morocco, and I sat in with some of the Moroccan players, and it was really cool. And my students the next day were asking me, how could you just sit in like that? And I turned it into an essential oil lesson, which is why I decided to start talking about it, because you listen, you pay attention, and you experience. And that's what working with essential oils are all about. So that is what my history is, and that's what I did. I was supposed to be a rock star, didn't quite get there, but I love the direction that it turned into, because right after I got off the road, now I wasn't a crazy, drug, addled rock and roller. It was unhealthy. It's an unhealthy lifestyle. So one of the first things I did when I get out of or off the road, I started studying nutrition and started studying herbology. And then I get into being a hairdresser. The reason I chose being a hairdresser is because I come from a Boston Italian family. My grandfather was one of the top hairdressers during his lifetime. And I figured, let's check it out. I loved it. It's another creative art that I just love doing. And then I ended up owning a spa. Now, my whole theme in my spa, and this was really early on when this wasn't very popular, was to be as natural as possible. And so I brought a lot of what at the time was called New Age philosophy, which is Eastern philosophy. So I brought a lot of Eastern philosophy in my work in nutrition, my work in herbology, and that's how I developed my spa and even my hairdressing. Then I found out about essential oils, and I became obsessed. I sold my spa, started just diving in and studying essential oils. Now, my background and what was going on at the time, there were very few aromatherapists when I started. And so what I studied was what's called French aroma medicine. And in America, we have a mix of what's called French aroma medicine and British style. And, those terminologies kind of help because British, French aroma medicine is just like it sounds. It was mostly doctors that were using this, started in the early 1900s. And so when you hear about the history of aromatherapy and even essential oils, I mean, it really started in the early 1900s. There's a history of aromatics, but it's not really the current use of essential oils. So French aroma medicine doctors, I studied with some of the top people. My very dear friend, Kurt Schnaubelt, was one of the first people who I studied with, and one of my mentors, Pierre Francombe, who, he wrote the book on clinical medical aromatherapy, along with Daniel Penawell, who I also studied with. So these are the people that I studied with. And then there was the British style of aromatherapy, which was more about massage and topical use and skincare, which is what I was doing with it. So this is my foundation for essential oils. Sold my spa, went into teaching, and where I first started teaching, first was with a manufacturer. Then I moved into teaching in spas, mostly in the aesthetic schools. So where I really learned my chops in education was through teaching women, and mainly women, age 18 to 24. Most of them were not, they didn't go to college. They went to, the aesthetic school. And the reason I point that out is because it's almost like rock and roll. These are people who are very creative and they aren't driven by, intellectual academic kind of work. Their focus is their creativity and their hands and their understanding and their skills in being really good at skincare. And that gave me a certain perspective on not only how I use and what I know about essential oils, because I have the experience, from my spa experience to teaching experience, but I also got to learn how to communicate with people about essential oils. This developed for a while, and then I ended up moving out to the Seattle area, co-founding a plant-based skincare company, because what I was teaching was not only the essential oils, but nutrition. And what I would tell my students when I was teaching in the aesthetic schools is the best thing for your skin is all the food that I'm also talking to you about that you should eat. And they say, well, where can you get that skincare? And I say, well, nobody's doing it. You can't get it. You can't find it. No one's doing it. And then I met a woman who was actually doing sort of the foundation of what I talked about. And she was a fabulous formulator. And so we got together and I brought in my nutrition knowledge and with her plant-based formulating knowledge. And we created these beautiful plant-based skincare formulas. We're in, if you're in the U.S., Whole Foods, you're pretty familiar with Whole Foods as being the premier natural market in the U.S. We were all through the U.S. in Whole Foods and a lot of other places. But it was such a challenge because it was still new. Plant-based skincare was still new. And this is another teaching experience, also a marketing experience, and also from the formulating, a formulating experience. So this is another piece of the puzzle that I'm starting to put together when I start talking about the triad. Boy, that was pioneering plant-based skincare was not an easy thing to do, but I loved it because again, it was that, how do I explain this to people? And one of the ways, and I still do this when I talk about plant-based experience, if your plant-based skincare is white, doesn't matter that the ingredients are real, but they've been overly refined and all the nutrients have been taken out. That's not cool. Your plant-based skincare should have color, just like your food has color. So there's a lot of elements to this that I learned, and again, teaching as well as marketing, which is a different thing than just education, and then the formulation. From there, I ended up teaching at Bastyr University, which is the top globally, internationally, the top naturopathic natural medicine school in the world. It was kind of redundant, international, global, and in the world. You get what I mean, though, right? It's cool. What a great experience that was. Incredible experience. I was there for 16 years. And through that, I developed the certificate program, which gave me even more skills in understanding essential oils, because not only did I have to teach from my experience and what I learned from French aroma medicine, I had to dig up what are called peer-reviewed scientific studies for essential oils, which there are a lot of. And this is where in the aromatherapy market, you'll hear this a lot, evidence-based. I'm gonna talk about that coming up. So Bastyr was an incredible experience because not only did I have to really have my chops together and my information really tight when it came to teaching, because I'm teaching at a accredited university. My information had to be right on and accurate. I was also teaching because I was outside of the curriculum. I was teaching, biophysicists, naturopaths, acupuncturists. I mean, you name it, whatever practice, they were there. Plus, there were lay people with no scientific background. So again, teaching skills. This helped me to understand essential oils even more because I had to bring that information where I didn't lose the scientist. My information was pretty deep enough to satisfy that knowledgeable base. But I had to teach it in a way where, it was even an accountant who was just wanted to learn for her own purposes in my course. How do I teach the biophysicist and the accountant at the same time? It was fun. That's what it was. But what I really loved about being a Bastyr, and this is where, what I'm doing now is I'm a consultant, so whatever your practice is, because of my Bastyr experience, I have learned to find out what you do. And I've learned a lot about, a lot of different kind of practices that are out there. So I have a lot of information, but I'm not a medical practitioner on any level, acupuncturist, Chinese medicine, none of that. But I know essential oils. So when I know how you use them, I can take my information and hand that to you so you can use the oils in your practice. And, as a consultant, that's what I bring to you is the skills to use essential oils. But as I say in all my courses, I'll give you the information, but the essential oils are yours. You do what you do with them, okay? That's not my role. My role is to teach you about the essential oils. Your role is to incorporate them into who you are and then who your clients are. So from Bastyr University, and from there, I actually was teaching globally. So I really got some great experience all over the world. It was just amazing, amazing, amazing. Let me bring up this again, because now that I didn't use my slides, because I already know who I am. I didn't need my slides to tell you, but I want to just tell you this part, because this is where we're going with the Triad, okay? The Triad has just worked out so well for me. This is what I've learned, and this is what my journey has taught me. One of the main things is that essential oils are not drugs. When you talk to people who are either selling essential oils or even teaching aromatherapy, they tend to isolate, put them into lanes. And it's a very drug-like focus that they're using. So yeah, there's an essential oil for everything. What do you have? Oh, you have that symptom? Well, you use this oil. It's not so accurate, because you do not choose essential oils for a symptom. You choose oils for the person with the symptom. Following me? It's, you're doing the same thing. If you have a headache, yeah, I need to choose an essential oil that's going to fix your headache. But I need to understand you in order to understand which oil I'm going to choose for the headache. It's sort of a random thing that you hear all the time, headache, oh, peppermint. I get headaches. Peppermint doesn't work on my headaches because I don't have a peppermint headache. So I need to choose oils that are going to fit who I am, what my needs are, and also, why do I have a headache? This is an important piece. And when I get to my outside, inside, out system, I'm going to explain how that works in relationship for selecting oils through the Triad, right? The holistic essential oil Triad. So also, chemistry is a big thing. I studied in depth the chemistry, because in French aroma medicine, it was really primarily based around chemistry. Pierre Francome created what's called the structure effect diagram. It's based on functional group theory. Now, just over the last few years, all the big names in aromatherapy are going, functional group theory, that's not really accurate. It doesn't work. And so they're kind of just tossing it out. That's that's why. Functional group theory does have a basis in scientific evaluation, along with the therapeutic properties that you find in the functional groups. So you'd have to take a chemistry course with me to understand what I'm talking about with functional group theory. But we're talking about the basis of understanding essential oils, which is chemistry. So you have stress, anxiety. Well, you use esters. Esters are a functional group. And in functional group theory, esters tend overall to work very well for reducing stress. So functional group theory does work. And the structure effect diagram kind of lays out from a electronegative, electropositive, it's a scientifically based chart that Pierre Francombe came up with. And through that, you can, if you look and you see, okay, esters are listed and they're calming. You look over here and there's phenols, and the phenols are antimicrobial and kill bacteria and antiviral and all that. That works from functional group theory, and it works from the structure effect diagram. Now, what I've done, and I developed this through my last year courses teaching, I taught a 3-day course on chemistry. Now, I already said that I teach essential oils, right? So I'm teaching scientifically based. These guys have a lot of chemistry in their background. In order for them to get their PhD and their medical degrees, they really have to know chemistry. I'm not a trained chemist, but because I understand, I had to study backwards to go back and understand chemistry in order to teach it. But what I teach is essential oil chemistry, and it's accurate. I know what I'm talking about. I know how it works, and I know how it fits, right? So from that really hard, in-depth study and then teaching of chemistry, I found that the chemistry is limited, and that's where the functional group theory people will go to the work. It isn't consistent, and so you need to understand it from what its value is, and its value isn't that this compound does this, right? That's symptom-based work. If you look at studies online, actually Google Scholar is a really good place to go, or the PubMed, which has all the peer-reviewed studies. I've looked at them all. And, lab studies are great, and they look at the chemistry. They'll tell you what chemical compound, because that's how they like to isolate things. But, you take that into the human body, it's not going to be consistent. And you know how I found that out? I was consulting with naturopathic doctors. A couple of doctors were using it in IV. What that means is they're putting essential oil directly into the vein, which they are licensed to do. And so what I was doing as a consultant is I was selecting the essential oils based on peer-reviewed scientific evidence, okay? The chemistry. And what I found out, it's not consistent, because there are so many factors, and this is my, what I have. Do I have this one on here? Yeah, that you're looking at the physiology, the human being. You're looking at the person. And even scent, the olfactory system, I'm going to talk a little bit about that. This can change that scientifically studied chemistry. You need to understand, not that essential oils don't work the way the science is saying, but there are dimensions, there are perspectives. There's so many things that go into this. And this is, again, the pieces of the puzzle on how I built the holistic essential oil triad. So chemical complexity. Now, quality is always an issue in essential oil. We have great quality because we GC test. GC test looks at the chemical structure of the oils. It tells you whether you have an adulterated oil or synthetic or whatever. I do that with my nose because that's how I was trained. Kurt Schnellbelt is one of the best essential oil resourcing masters in the world. And he was my mentor in that area. And so through Kurt, I really learned the nuances, but I also learned how to smell an oil and detect adulteration. And what I'm smelling is complexity. I have taken a sniff of oils that are GC tested or GCMS, if you want to go the whole route, for purity and all this wonderful stuff. And, I smell them, I said, well, they're flat. Yes, it's a real oil, but this is flat. And what I mean by that is I don't smell that dance. I don't smell the love that came from the distiller. It's flat. It's not as complex as it could be. That doesn't mean it's not a good oil. That doesn't mean it's not a pure oil. It's just that for me, quality is complexity. It's the dance that that essential oil gives to you. Dramatic pause as I do flip. Okay, so here's another thing to understand. Essential oils are multifaceted. Now, what that means is they're like a diamond. Depending on what facet you look at, changes what you're going to see about the oil. And this is where all of the different pieces come together, because just like a diamond, each facet is not isolated. Each facet is part of the whole. So there's so many pieces, so many facets to understanding essential oils in order to get the most out of them. And again, this is from all of my teaching, from my experience, my background. I mean, I've pretty much been in almost every area of essential oil knowledge that you could possibly be in. And so my understanding is from all of these different facets of the essential oil diamond. And what I found out, this is what I have here, is the more you know, the more you realize what you don't know. And then the more you recognize what you don't know, the more possibilities you create. This is where rock and roll comes in. I don't know the rules. I don't know the rules of chemistry. I don't know the rules of physiology. I do know the rules of essential oils, because essential oils are rock and roll. They don't have any rules. They give you guidelines. They give you direction. And as soon as you know how to play that instrument, you can jam for a lifetime. It's just such a beautiful creative art working with essential oils. This is cool. This was a part of the study that blows me away pretty much. Sense of smell, our olfactory system. And this is just in general our sense of smell. This doesn't really have anything to do with essential oils until you get into how essential oils react with the olfactory system. So the olfactory system, through smell, when you smell, it's molecules that go up your nose and attach to nerve endings. And then they signal through the olfactory bulb, sending a signal to the limbic system. Within the limbic system is what's called amygdala and hippocampus. This is where your memory and emotional centers are. So the way it's said is every memory, every emotion has a scent attachment. This is powerful when you really understand that. And what I've done is I've actually turned that function into a therapeutic tool. So I know I'll probably do a class on this, behavior modification. How do you change behavior? How do you stop bad habits? And the system that I've developed is through the sense of smell. And it doesn't matter what's, aromas. I could use synthetic. I could use anything, but I don't. I use essential oils because essential oils have an ability to trigger certain reactions through that limbic system response. But it's understanding just the basic function of the sense of smell that you need to do. So scent is both emotionally and physically effective. So a lot of people think, when you smell it, it's for emotions. No, I can reduce inflammation. In one study, I found you can burn fat cells with grapefruit. I asked my students, well, how would you do that? I said, well, you drink it. No, well, you could, but you don't have to. Smell. The study was on inhalation, and it triggered a response through the olfactory system, through the limbic system, into the central nervous system to burn fat cells. Don't you wish it worked like the study says, though? Like I said, physiology kicks in. Studies are good, but physiology always kicks in. I just posted this on LinkedIn with a poll about, what is the most impactful scent, what was the most impactful scent has ever had? And people have a lot of different ones. It's a love, a relationship. You smell their perfume, you smell their t-shirt, whatever. And then there's a whole list. And one of them is actually PTSD, anxiety. I once had a woman in class who every time Rose went around, she'd leave the room. So that was beyond, I don't like that, pass it on. There was some anxiety, an emotional anxiety attached to the scent of rose. Now, we all know rose is calming and beautiful. Who can't love rose? Well, this woman can't love rose because somewhere in her childhood, most likely, she had an anxious moment, could have been a PTSD kind of situation. And so every time she smells rose, it doesn't trigger the memory. She doesn't go, oh yeah, I remember it caused me, it was awful. She only has the emotion, the anxiety. This happens to all of us every day, all day. Fragrances trigger and manipulate our behavior. I need a whole 3-day class on that one, don't I? So I'm just gonna do this one real quick because I want to move into the triad. We're really getting to that point because I want to leave some room for questions. Okay, so this was a really cool study. This is why essential oils aren't our drugs. And this is why intention, when I show you in the triad, intention becomes part of this. What I say matters. If I give you an oil, and this was how a study was done, I give you an oil, I say, here's a calming oil, and you smell it. If I did brain wave readings and skin conductivity, you're going to respond as a calming oil. Now, if I bring someone else in the room, I say, hey, I'm going to use a stimulant oil now. Smell this. It's going to give you energy and it's going to stimulate you. Yep, brainwave readings showed to be a stimulant. The oil, both times, was lavender. And that's how they did a study. And they used lavender both times. And through the study, through the brainwave readings, lavender was calming when it was said to be calming. Lavender was energizing when it was said to be energizing. This is why I bring quantum physics in. It's like, if you know quantum theory, you ever heard of the double slit experiment? Check that out and then compare that to what I just said. What you ask for is what you get in the double slit experiment. All right, so this is the power of the olfactory system, okay? And all aromas affect us. I've already said that. All aromas affect us in this way, not just essential oils. We can direct essential oils because we have therapeutic properties that we know exist, but we have to give them direction. They don't just exist because they do that as like a drug, because essential oils don't work that way. Now, when you get into bigger molecules, yes, like if you drink a lot of coffee with caffeine, caffeine is a larger molecule that behaves more like a drug. Essential oils are smaller. They're more subtle. They work on, it's even hard to bring words to this on the level that they work at because they are powerful. I think I had sinus infection and I used oils to treat it and boom, it worked. That's a very drug-like activity, but I needed to know how to use them in order to make that work. So holistic essential oil therapy. This is what I'm going to bring into this. And this is what oils are all about. I think they're the most holistic tool you could possibly have, especially in skincare, spa, and wellness therapy and institutes. So they work on the emotional, the physical, and energetic health. Now, I'm always a little about describing energy and energetic health because it's hard to explain that. I know a lot of people who work in frequency and energetic medicine, and so those are my go-to people to understand that. I know I'm working energetically. I just don't always know how. Okay, so that's the holistic piece. You need to know that. Now, holistic application. We think inhalation, put a diffuser on, smell it off a stick, do this kind of thing. This is what's weird about these online things. It's like every class I want to go, okay, I need you to smell this. You getting it? You smelling it? Good? Yeah. There's no smell-o-vision either. Anyway, what were we talking about? Yes, holistic essential oil application, inhalation through a diffuser, smelling it through the olfactory system. But we need to understand it's not just emotion, mood with inhalation. We are working physically on the body as well. Digestive system, respiratory system, cardiovascular system, inflammation, all of these things. But you also are working on memory and emotions and mood and, energizing, all those things that we think of inhalation. And then topical use is more physical application. And, from a physical perspective, I can talk to you about cell receptors. The essential oils are like a key that fits a lock, which is a cell receptor. When it hits that and turns that key, it triggers a response in the body. That happens. Okay. Even just from topically putting it on your skin, a lot of people think it has to absorb. There's little absorption penetration into the skin with essential oils. I mean, there is, but it's not what you think. A lot of the activity you get from putting oils on topically are from cell receptors in your skin, lock and key, triggering a response. That's why it can be so immediate. The other thing that happens, you're smelling it. There's an olfactory response. So you have not only the topical receptor response, but simultaneously you're inhaling it. Now, when we think about olfactory and topical, this is also how we deal or work with the chakras and energy centers, meridians, marmas, and all the things that we consider energetic. So what have I just done? I've just described the holistic essential oil triad. And the triad, I designed this system so we understand all those puzzle pieces that I just gave you and how to put it into one system of use instead of separated, in your lane. I do it topically. I do it inhalation. No facet. It's a diamond. All facets together make the diamond. All facets together make the essential oil. So what the triad system is designed to do is to give you more precise and effective uses for your essential oil. That's what it's for. So the triad system, we're looking at all three of those functions that I just mentioned, okay? Happening simultaneously, olfactory response, pharmacology. So when I talk about pharmacology or use that term, when we think about pharmaceuticals, they're molecules designed a key to fit a lock to create a response. They tend to be very one-dimensional, where essential oils, and this is why complexity is so important. When you have complexity, you have many molecules, many keys. It's like a janitor with a lot of keys hitting many locks, which when there's one response, there's more harmony within the system, which means you're going to avoid side effects. Because if you have one-dimensional lock and key triggering a response, if there aren't other harmonious responses happening, the body is going to respond. And the body can respond with some of these things we call side effects, right? Olfactory, pharmacology, and then the energetic. The metaphysical, sometimes I call that, I don't know, category, because I don't know. There is studies on meridians and how they are, and pulse points, pressure points, meridian points. And in a way, those points could be clusters of receptors. So there could be a physical response, but it's basically, I don't know. But if you know how to work with that, if you do Chinese medicine, if you do Ayurvedic medicine, you learn how to work with that. So does it matter whether there's any paperwork to tell you why it worked? No, it worked. And that's what's important here. We need to understand that we are creating results. We're creating systems based on traditional knowledge that goes back thousands of years. And my whole process or understanding on, traditional knowledge, that Ayurvedic stuff or that Chinese, it's silly. It wouldn't have lasted thousands of years. I call it pre-ego and pre-financial benefit. If there was a system that you used back when you didn't really have ego attachment to it and there was no money to make from it, and you said, oh, you're going to try this for this point, it'll really work for your headache, or try this, it'll do this. If you pass that on and it didn't work, the whole system would have died. But it's because it worked that it continued to be passed on century over century. So these traditional therapies, they're solid in peer-reviewed, evidence-based scientific knowledge, because they've been passed on for so many years. So let's take a look at this. Olfactory system. Scent, memory, emotion, has the interactions with the central nervous system and the autonomic nervous system, meaning that we're going to get physical responses. So when I talked about cardiovascular and respiratory and digestive, that's mainly through its effect, through smelling, balancing out the autonomic nervous system. Pharmacology, like I said, cell receptor activity. And then the metaphysical, which is chi, chakras, meridians, marmas. I have a friend who does muscle testing, kinesiology, and he's very successful in his practice. He does use essential oils. This is all real. Now, what I want to tell you is that this stuff is not happening in isolation. There isn't an olfactory response or a pharmacology response or a metaphysical response. Quantum physics, again, it's not an either or. It's a both and. It's olfactory, pharmacology, and metaphysical all at the same time. The more you understand about the olfactory response of essential oils, about the pharmacology of essential oils, and about the metaphysical properties of the essential oils. Am I getting a little Italian on you here? I told you, I brought up in a Boston Italian family. Anyway, those three things are happening simultaneously. So when you know what your oil does from each level, you're not only choosing for one lane, you're choosing for the whole response. Now, you may be focused on one thing. If it's pain and you're using an oil for pain, well, what does the olfactory system have to do with that? Well, a lot. You work on the central nervous system, you work on the autonomic nervous system, because those things actually could be causing the pain. That's what gets me to my triad. Actually, it's going to get me to the outside, inside out method too. So this is the holistic essential oil triad, okay? I put this together as a Venn diagram so you can actually see visually what I'm talking about. So over here we have olfactory. Now, mostly we think memory, emotion, and the bonding that goes on. That only happens through the olfactory system, okay? But it triggers limbic signaling. And I only have one thing in there. I mean, it triggers many things. But I wanted to show you in this Venn diagram that response has a pharmacological, physiological-like response that goes into the pharmacology category. So in pharmacology, you're going, yeah, autonomic, central nervous system, reducing inflammation, reducing cortisol. It could be coming from an olfactory response, but is a pharmacological response. So you can't separate olfactory and pharmacology. And then we have the metaphysical. So what I've written down here is energetic, chi, prana. I want you to look over here toward the olfactory system. And what I wrote in there is intention or verbal cues. That's when I was talking about the lavender story. And if I tell you it's calming, it's calming. If I tell you it's energizing, it's energizing. So much of what you do as a therapist is based on the language and the intentions that you present. That is powerful. And that falls into the category when, a lot of the mainstream scientists and doctors will kind of go, oh, it's because you're telling people it'll work and they think it'll work and it's placebo. Beautiful. If you can heal somebody just by simply saying, your illness is gone. How cool is that, right? And that does work. I mean, there's been enough studies on intention and prayer healing and things like that. But when you use intention with emotional memory bonding, this is my behavior modification system. It's powerful. And for pharmacology, when it comes to metaphysical, that's what I was talking about with the marmas and the meridians when you're on pressure points or meridian points, whatever it is you're working from, acupuncture, acupressure. There's a physical response there. And I don't know enough about it to know if it's actually been studied to that point. I think I've heard that. Maybe that's why I'm saying it. But like I said, it could be a cluster of receptors, or one receptor, that when you're hitting that, you're triggering molecular activity that could respond with that cell. So boom, you have pharmacological activity. This is the holistic essential oil triad. This is the puzzle that I've put together based on all of that cool history, including my rock and roll kind of thing that I did for years. It all went into this. And it took me until, I think last year is when I really fully developed this. I'm not finished. Because now I need to tell you about the outside, inside out method. Now, what I didn't mention is that I'm not telling you anything new here. This is old school holistic theory, really, mind, body, medicine, or mind, body, spirit, which I've always found, I really like to dissect definitions. And in the first part of my essential oil certification course, the one I did at Bastyr especially, that's what we did at the start. We dissect all these definitions: essential oils, aromatherapy, and holistic, being mind-body medicine, which I find to be limited. I wrote an article, I think it was for Skin Inc. magazine, and the article was titled "How Whole is Holistic?" And basically, I could have answered that without writing the whole article. It's infinite. You're never done with how holistic something is. And mind, body, spirit don't really define what's going on, because what I just defined is mind isn't just thought, it's physical, it's olfaction as well. Emotion and memory are stored in there. But it isn't only mind, there's physical activity going on there. So mind, body, spirit is a word there. What does that mean? Depends on who you're talking to, right? So that's why I use metaphysical. Metaphysical is a word that, you can interchange it with spirit. But in order to be accurate in your discussions with your clients, you need to be talking the same language. You could be saying spirit and they hear spirit and they're thinking something totally different. Maybe they were brought up, watching Casper the Ghost or something. So every time you say spirit, they think, why is Casper involved in my healing therapy? I don't get it. Know your definitions. Explain it well. Discuss things. Be on the same page when it comes to definitions. So this holistic model, what you generally hear is beauty inside out. Of course, what I'm going to say, I find that limiting. So what I did was I gave it another word, another dimension, another facet to the big diamond of holistic health, I guess is what we're talking about. Outside has to be there as well, because what I'm talking about is that you need to understand what's going on out here in a person's life in order to understand how they internalize it. So take two people. They're in the same situation. They're dealing with the same external stressors. One person is freaking out. The other person is just calm and floating right through whatever comes their way. So the outside influence is the same. So you need to identify that first. But what's important is not just inside out. It's how they internalize that outside influence. Because, like I said, some people respond negatively. Some people just aren't affected. And this is actually part of my behavior modification, because I'm trying to help people identify what's going on out here and identify how they internalize it. Now, I select essential oils based on what's going on out here and how they internalize it, right? I said this in a conversation I had the other day where the discussion, it was actually a really cool GC chemistry class that Dr. Satya is doing. And in that course, I was talking about, the external, right? So, I live, like I said, I'm in the city. I'm right down the hill from all the TV towers, so is that affecting my total insanity? I don't know, but probably, right? So when we're talking about the chemistry, we're talking about where the plant grows. It produces those chemical compounds to harmonize with its environment. And when you understand the plant and its environment and why it's producing those compounds that we're using as essential oils, if you can match the outside influence that's affecting that person to a plant that has a similar outside influence and the way it's developed the essential oils to harmonize with that, that's helping your essential oil choice when it comes to that person. Again, they're not drugs. You're not doing it for the symptom. You're doing it for the person with the symptom. And so this is the piece of that you need to understand. The from the outside, how they internalize it. That's so important, how a person internalizes it. And that comes from, their philosophy and their thoughts and everything like that, and it could be lifestyle and diet. You see some people who eat really horrible diets and they tend to be okay. You see some people who eat, their diets are only minimally bad and they're in horrible shape. Everybody's different. You need to understand out here, you need to understand the individual in here and how that comes outside. And that's the symptom management. So in skincare, you can see eczema, atopic dermatitis, which can be caused by so many internal influences, but you have to know what's coming from the outside, because the outside could be those crazy radio towers that are right over my head, TV towers, right? All that electromagnetic frequency. If I had eczema, I'd want to consider that. Now, I'm underneath it and I don't have any skin symptoms like that, but I bet I could find people in my neighborhood that do. And I bet with a little bit of research, I may find people who are that atopic dermatitis is due to the electromagnetic frequency because it causes oxidative damage. I have solutions for that. And that's what the whole Triad thing is about. Okay, so here's where I want to leave some room for questions, of course. But again, this is my work. This is what I bring to the spa therapist. So, I keep saying, I'm a consultant, and people go, well, what are you consulting on? This is it. No matter what your practice is, no matter what it is, I can help direct the use of the essential oils instead of it being so random, reading a book and go, oh, this one's for a headache and this one's for atopic dermatitis. And this is, that's nice. And it works sometimes. That was the other thing. I found that these French aroma medical guys, I have their books, and you know what? Their recipes don't work. I'd say maybe 50% of the time they work, but I have to adjust them for the person in order for them to work for that person. And so that's what this is. That's how you apply the Triad system. That's what I teach. That's what I do. So using the outside, inside out framework, this is what you start with. You need to know who the person is. That's going to get you to your intended therapeutic goal. What do I mean by that? I have an 8-step system in building a treatment. And so you're building that treatment. The first thing you know is, where do you want to go? This is your GPS. So yeah, the goal may be to eradicate, release, reduce an illness or a symptom. That's your goal. But the goal doesn't mean that's what your therapeutic process is going to be. That's all this other stuff. That's applying the Triad. That's applying the OIO system, outside, inside out. Now, what you're doing is you're in this. First is a goal. Now, in my steps, I actually have goal. What are the properties you need to satisfy? And then I get to chemistry, and then, so 8 steps that go to that. But let's just do the symptoms. What are the properties of that symptom? But in order to figure out what the properties are, you also need what are the causing factors, which is the outside, inside out method is going to tell you what's causing that symptom. What are the things you need to look at that are from outside to inside? You might need to be working your essential oils to, for, again, that example, EMFs. What I do is I load you up with antioxidants because that's mostly oxidative damage. Same with the sun, UV damage, oxidative damage. So what do I want to do? I want to have the plant that produce powerful antioxidants to prevent the UV damage that they're exposed to. It's going to help protect you from the UV damage or from the EMFs or whatever it is that we're dealing with here. So goal, symptom, properties, causative factors along with the symptom, right? You look at atopic dermatitis, I need anti-inflammatory. That's symptom management. But it also may be internal management, causative factor management, because cortisol release and causing inflammation, which can break down the lipid barrier, which can cause atopic dermatitis. What am I looking at? I'm looking at stress levels. I'm looking at fight or flight response. See how many layers you can go through to make this work. And your oil selection is going to be so precise when you work from this system. You know what I'm going to do? I'm just going to almost close it there because I'm going to tell you, I'm going to get to questions right after this. So you're going to look at all the selection, considering everything I just said, olfactory, pharmacology, metaphysical, right? This is what you're working on. And so when you have that in everything that you do, every process you do, you're looking at olfactory, how am I going to address it from the olfactory system, sense of smell? How am I addressing it pharmacologically? And it could be a diffuser, right? Diffuser is inhalation, we think, but you're going to get essential oils on your skin. and through olfaction, pharmacology. Energetics, the energetic of the oil. I mean, that's where it's like, I don't know, but yeah, this person responded really well energetically to this. Okay, so if I have some questions, I'm going to get to it. If I don't, then I'm going to babble some more because, man, I've got 10 minutes left. I'm going to do this for an hour, and I've 10 minutes left. And in that 10 minutes, I'm going to answer questions. And if not, I'm going to make up some more stuff. No, I will. I'll come up with something symptom management. Let me see. What do we got in there? Let me see. This is the chemistry, but how it interacts with the person. The chemistry. Oh, let me start here because this is a good one. Hi, Anisha. Isn't the chemistry? Isn't it the chemistry, or is? I'm not sure how that works. Isn't it the chemistry, but how it interacts with the person and their chemistry and physiology as well? Which is kind of what I was saying. Yes. It is the chemistry, though. Okay, so I have an oil, Virginia cedarwood, which is Juniperus virginiana. You should always know the botanical name. And in that, there's a compound called cedrol. Now, what I just learned so much just from random searches, right? And I found a study on a chemical compound called cedrol. And cedrol was shown to raise parasympathetic activity. And, I look at the fight or flight response, which is when you're in hypersympathetic mode, which causes inflammation, respiratory issues, cardiovascular issues, digestive issues, right? When you're in fight or flight. So the parasympathetic nervous system slows down heart rate, slows down respiratory function, and puts more energy into digestion. That's why you get tired after a meal, because your body goes into parasympathetic mode and the energy needs to go into digestion. So the chemical compound, it is the chemistry having a chemical response, but I still need to know the person. I still need to make sure that that chemical compound is going to work with that person. So yes, how it interacts with the person is extremely important. Yes. What else we got going on here? Anisha had another thing where PTSD in oils, also the rat study with geranium. I'm not familiar with that one, but we should talk, Anisha, because there might be things that we could share. You got a lot of good questions here. Let me see if anyone else does, because I'll go back to you. Patricia was asking if we can watch this again, and yes, we can watch this again. And let me see. Let me pull up Patricia's question. Behaviors of dementia with the use of essential oils. When someone is in the end stages of dementia, is there a way to use this system? Yes. Creatively. And this really gets to the person. One of the things that it never happened, but I was consulting with a assisted living home, and it was going to be in the area with severe dementia people. And my thought in that, yes, there is actually studies, lots of studies, and you could actually go with these studies. It'll work. Because what the studies show is that, I forgot, Melissa, lavender, the ones we generally know as calming oils, they show that agitation, all the negative aspects to dementia, I don't know if there's any positive aspects, but the negative aspects to dementia were reduced. So calmed the patients down and did everything it needed to do. Now, what I wanted to try, and one of the things about this, before I tell you what I wanted to try, is that dementia patients tend to lose their sense of smell. When you lose your sense of smell, that actually can cause a lot, depression and a lot of disruptive emotional behaviors when you lose your sense of smell. People just don't realize how important your sense of smell is and how much impact it has on everyday life and emotions and behavior. So what I wanted to try that I never had a chance to, I think because too expensive, maybe, I don't know. I wanted to talk to mostly the children of these patients, and as much as I could with the patient, find out what their childhood, where did they grow up? What was the environment? What were the plants that grew there? Because I wanted to select oils that would be a part of their most positive memories. They'd have to have positive childhood memories for that to work. But let's just say, one of the kids talking, he goes, "Yeah, Dad loved being out in the work shed, and that's why I really love the smell of sawdust." And so I can get a sawdusty smell from some of the wood oils that I use. Virginia cedarwood would be one of them. The arbor vitae, which is also called red western cedar, which is Thuja plicata. That is, when it comes to blending for fragrance, oh man, is that one a tough one to blend? It is so overpowering. But if I wanted that for that woodshed sawdusty fragrance, it'd be ideal, it'd be incredible. And so there are elements to how you can select oils based on what we know about the chemistry and how that works. I think working through the autonomic nervous system is always good. Marjoram, the Virginia cedarwood, like I said, bergamot, lavender, these have all been, said to work in balancing autonomic nervous function. So yes, Patricia, there's definitely ways to do that. And that's why my system is about you, okay? You are the therapist. And the more you know about the oils, the better you will be. And that's what I do. That's my role, is to teach you about the essential oils. Because, like I said, I come from a very structured medical, French aroma medical background. And that's supposed to be, very scientific and studies and evidence-based and all that good stuff. But when I found out it wasn't working, that's when I had to discover and work and experience, and all the experiences that I had helped me to guide you guys as therapists. What else we got for questions here? Oh, you're saying yes. Anisha says yes, Patricia, to that. She's worked with assisted living. Yeah, I don't know if all you guys can see this. See, I'm also, I don't know if I saw LinkedIn that I'm looking at, because I'm on YouTube right now too, and I can't see my YouTube guys. But hey, you YouTube guys, I'm supposed to say subscribe, like, and say nice things about me in the comments. You too, LinkedIn. I mean, it's all that promotional marketing kind of stuff that I just absolutely love so much. Any essential oils for the heart? Let me pull this one up for heart health. Yeah. But it depends. Okay, so now you have a symptom, cardiovascular. What am I doing about the cardiovascular system? What do I know about the cardiovascular system? So I've already talked about being in fight or flight. And this really has to do with age and diet and lifestyle. These are also things you need to know. And this is where the challenge is. You have to work from your scope of practice. You can't go beyond your licensing, right? So in that context, you need to know when to recommend other therapists. That's why it's great to be, if you're in a whole wellness studio with different therapists, right? You need to study. You can't tell your clients any of this. I'm supposed to do a disclaimer. Everything I say is for entertainment purposes, and nothing I say matters, because I'm not a medical guy or anything like that. So that's not an official disclaimer, but you know what I mean. So in context of heart health, there are essential oils, like I said, working through the autonomic nervous system. If that's what you're finding for causative factors, you want to calm the central nerve, calm the sympathetic nervous system, raise parasympathetic activity, which in studies has shown to balance high blood pressure, because high blood pressure tends to come from stress. Now, it could be coming from diet. You can't do anything about that with essential oils. You can only support. That's where behavior modification. If somebody eats really bad food and they're addicted to it, because there's that dopamine rush that you get from those addictive foods that are created scientifically in a lab to be addictive. Okay, and so it's a real addiction. Those nasty foods. Now, how am I going to change somebody? I can't work with essential oils and expect to fix somebody that has a really bad diet. In behavior modification, I guess I'm going to need to do a class on this. I can help them change their behavior and their habits through essential oils. And I do that through the olfactory system and some of the properties of the essential oils. There are oils like cypress that's been documented for being a vein tonic. And so that would also be cardiovascular. There's so many elements to this, but to help improve cardiovascular health, yes, it's like, yes, there are essential oils. You just have to know all of the other symptoms. Let me see what else is going on in there. Essential oils for hormonal balance. You know, who am I to say about that? But let me just tell you something. I was brought up by all women, and being a rock star associated with women. And it was when I got into the hair thing, it was all women. And then getting into teaching in aesthetic schools, it was pretty much all women. My whole life has been centered around women. And so I have experience in supporting women's health and hormonal health. I don't have the experience of ever dealing with it. But when I see the results, yes, I know what to do. I actually did a course. This might have been the online Russian courses that I did. It was, I'm gonna have to put it out there. Oh, I know where I did it. NASNPRO, NASNPRO. I know Denise isn't listening today because she's got an event going on in Virginia Beach or somewhere like that. But NASNPRO TV, you can go there and find my course on hormonal balance for women. I do not look at the hormones themselves. I'm not looking for essential oil that does anything with hormones. The clary sage has what they call a phytoestrogen compound. And so clary sage has always been associated with helping women with PMS and all the what's considered the imbalances in female reproductive health, and mostly blamed on hormonal imbalance. I don't see it as being hormonal imbalance. Again, I'm not a woman, I don't know. But I know my systems have worked. And with the phytoestrogen, so it was seen that the phytoestrogen binds, like I said, lock and key, binds with the estrogen receptor, and it would be assumed that it triggers the estrogen response. But what was later found is that phytoestrogen doesn't behave like an active estrogen. So it binds, but it does not create an estrogen response. So that takes away from clary sage being an estrogen active compound. Clary sage works extremely well when there's hormonal balance, because what's the symptoms of hormonal balance? That's when you have the PMS and cramps and all the other things that go in with that. Clary sage, due to when I talked about functional group theory, has esters. Esters directly address all of the causes of those symptoms. So it can relieve cramping because it works on the central nervous system, muscle tension, and emotional stress, mood. I mean, clary sage is just amazing, but it's not because of the phytoestrogen, it's because of the ester content. So working with hormonal balance, this is what I focus on. I focus on that outside, inside out factor or method in order to choose what essential oils I'm going to use for hormonal health. I'm going to take one more question, even though, I can just talk forever. You know how that is. Shaletta saying, lucky me. Yes, lucky me. I love women. I love working with women. I just absolutely adore it. But like I said, I was brought up by all women. My father left when I was a little kid, and I was brought up by my aunt and my grandmother and my mother. And, it made me what I am today. I don't know what that is, but yeah, I like it. I like the mood and the groove of how women are. I like that, and this is from a therapeutic perspective too, because as a therapist, I find it easier to work with women. Not to be dissing on myself, but I find men to be a little bit dense, and it's harder to kind of get through some of those barriers, where women are more open because the yin aspect, the female aspect, is more nurturing and all about healing. And so as a practice, that here's an energy thing, metaphysical, that yin energy just works for me. Okay, so I think I'm gonna call it off. I have coming up on May 4th, and I'm doing it at 10:30 a.m. Pacific time. That's a Sunday. I'm going to try and find more times because I have such an international audience, and it's so hard to even making phone calls internationally. It's like, you want me to be online at 5 a.m? Okay. But I'm doing it at 10:30 a.m., try and get a little bit earlier for people over, I guess I'm going to get as far as Europe on that one. And it's going to be actually this part 2. And what I'm going to do is I'm going to do therapeutic systems using the essential oil triad. All right. So here's, if you guys want to just, send me a message. I did put, you can get 30 minutes with me. That's online, jimharrison.com. It's, somewhere on my website, the top of it, if you just click it, it'll show you all the different categories of consultation that I do. If you want me to come into your spa, I would love to, or do an online course like this for your staff, I can do that. But I have all that. I have all that on my thing. If you just want to, send me some questions, get some personal stuff going on here, support at Jim Harrison is where you're going to find me. And I just love doing this. The more you engage me, the more you're going to find that I'm going to continue to talk. But I just so appreciate you guys. And thank you so much for being here. And I will see you again, May 4th, 10:30 a.m. Pacific time. Thanks. Have a good one.